information is fairly recent. It's about, a week old, but per your district, in the last 4 weeks, in zip code 132, there have been 41 cases. In zip code 133, there have been 52 cases. In zip code 134, there have been 30 cases. And in zip code 140, there were 37 cases. And so only in zip codes 133 and 134 were there a net increase over the 2 weeks. So we are seeing a pretty big, it was like an 89% increase in zip code 10033, and it was about a 31% increase in zip code 10034. So, I mean, this obviously can attribute to many, many things, right? I think as the city continues to open, people are feeling more comfortable, and we're seeing that behavior is really something that we want people to pay attention to. So we're not targeting specific groups of people. We're not saying that, people of a certain religion or whatever need to be more careful, right? The virus does not discriminate. Again, it has no boundaries. It affects everybody. And so this is more a matter of behavior and doing the responsible thing and protecting all your neighbors, the vulnerable among us. There are so many people that we really need to do the right thing for. And that really means to stay home if you're sick, wear face covering when you're in public, really don't gather in large crowds with people who are not your immediate family members, because we're seeing that this is, as a result of this behavior, we're seeing significant increases in cases. And so, again, we want everyone to go get tested so that the data is as accurate as possible. And the reason why we want people to get tested is so that we can really go and mitigate and prevent these clusters from spreading into larger community transmission, and where we have to revert back to the beginning of this pandemic when everything was shut down. That's the last thing we want for businesses who are trying to reopen. That's the last thing we want for people, who are just starting to go back to school. So, these are all things that we as New Yorkers should be focused on, and really just not doing it just for ourselves, but really doing it for the most vulnerable among us. So that's the biggest takeaway I wanted to share with everyone today. It looks like your neighborhood, 2 out of the 4 are doing good and 2 out of the 4 are having some issues. If you guys live in those zip codes and know maybe potentially why we might be seeing an increase in cases, definitely let us know. If it's an issue of people gathering, if it's an issue of people not wearing masks, we can designate folks. So the mayor has designated specific inspectors to the neighborhoods that we're seeing this increase. So if in your neighborhoods you're seeing areas of concern, definitely let us know, let the mayor's office know, so that they can delegate and put resources into the community to make sure that this doesn't become a bigger problem. We really want, again, to just emphasize that we can't let our guard down. And also flu season is starting. So we really want everyone to go and get their flu shot. If you could prevent disease and prevent overwhelming the hospital system as we enter into flu season, that's a thing to do as well. So again, really, it's just a message for all of us neighbors to do our part in making sure that we keep transmission levels low, keep ourselves healthy, and really do what is right for our neighbors. So I am happy to answer any questions if anyone has.
Pauline?
Yes.
Did you say that there was an 89% increase?
So only just over the last 2 weeks. So it's taking 4 weeks of data. And so it's just comparing the last 2 weeks to the beginning 4 weeks of whatever time frame that was. And so because zip code 0033 had a total of 52 cases in the 4-week period, the last 2 weeks had an increase. And so it was an increase of 89%. So it doesn't mean that there's like a gigantic spike in the neighborhood. It just means in the last 2 weeks, they're seeing an upward trend. Does that make sense? And I encourage everyone to go onto our data page to like look at the data for yourself and read through everything that is provided, because I'm not a stats person and I don't analyze data regularly. So, you know, there are things that maybe you can get from the data page that I may not be explaining as clearly as possible.
Okay.
I had a couple questions. You done, Steve?
No, not yet. But can somebody get Betty a glass of water?
Oh, no, I'm sorry. I apologize. I didn't mean to cough. I'll see if I can mute myself. Sorry about that.
So, Pauline, when I checked the website, I check the website every now and then, and last time I looked was September 22nd, 8 or 9 days ago.
Yep.
And the number of increased cases that I found in zip code 33, I found an increase over the last 9 days of 19 cases. So it's sort of strange then that there would be such a sharp increase over the last 2 weeks versus the previous 2 weeks. When in just the last 9 days, I only see an increase of 19. I don't know.
So it's based on data and there's a lot of feedback. Can people mute their lines?
I don't know. Tonight, this sounds like it's the unhealthy committee. So somebody else has to mute. I'm hearing a radio or something.
Maria, you have a second mic open. Maria Luna, if you could please mute yourself. Barbara, well, Mary. Sorry for you guys on the spot.
How come I am mute? I am mute.
There's two mics for you, Maria.
Yeah. Why is she here twice? Yeah, the day Maria Luna is mute. I want to know when that is.
Check out someplace else. I don't know what you're talking about.
All right.
Let me get out of it. No, I don't know.
Maria, are you on two different lines?
No.
No.
Maybe you could mute your phone. It doesn't have to be WebEx. You could mute your phone too, if you're on the phone.
Maybe you're on the phone and your computer?
No.
That's better.
Okay, it looks like I think we have a majority of folks who are muted now, which is, thank you, I appreciate it. Yeah, so I mean, Steve, if you're checking the website pretty regularly, you will be seeing, either increases or decreases in, testing rates and confirmed cases. So as it relates to the districts, the zip codes in your district, as I mentioned, in the last 4 weeks, there were those total number of cases. And then the difference, so the percentage change is from the last 2 weeks as compared to the first 2 weeks of those 4 weeks. So I hope that clarifies things. So there is a downward trend in 2 of the zip codes, and then there's an upward trend in the other 2, which could change in the next 2 weeks as well. So
yeah, it seems like it could, it could easily go up and down. But on the positive side, I don't detect any additional deaths. No, nobody. I mean, we've got more cases, but the number of people who have died from COVID in all 4 of our zip codes appears to have remained stable, at least for the last month or so. And we don't seem to have had any additional deaths, which at least is much better than where we were just a few months ago. Let me just ask one other question. There was a story that came out, I think, just yesterday, showing that there was an uptick in the positivity rate in various zip codes, including zip code 40, which showed, I think, 7 additional cases, which they said was a 4% increase. So what were those 4 cases in just one day? I mean, how did we get to a 4% increase? What was the significance of that report?
You know, I'm not familiar with that specific report, so I can definitely bring that back to our data team. I've been getting a lot of feedback from community boards and community members about why our statistics and our data are based on, when we're talking about rate, based on a number of 100,000 per population or whatever, because each neighborhood and each zip code obviously does not have 100,000 people. And so that number is often inflated to meet that 100,000 baseline number. And so I think that causes a lot of confusion because the real number is much less than that, but the rate is much higher because it's using that 100,000 that that baseline number. So I think that does add to a lot of confusion for our data. I think we've requested to our data team to include a chart maybe on our website to explain the difference between actual number and rate. So I don't know that specifically that article that you mentioned, but I'm happy to bring that back to our data team so that they can clarify what all of that means. So again, I'm not a statistician, is that what they call them, or a person who deals with FE and data. So I apologize that that's not my background and I can't explain statistics better to you. But I do know that there is what's caused confusion among folks when they're looking at our data page is the difference between actual number and then the rate.
Well, what just seems strange, I have to say that, I'm glad to hear your report tonight because you're saying that in zip code 40, there's a downward trend because the story yesterday seemed to suggest that we might be at some kind of critical stage with an uptick in the percentage of reported cases. So,
right. I mean, it might have been an upward trend for, the previous couple of weeks, but then just in the last 2 weeks, with the percentage of folks testing positive, we're seeing it going back down. So it's really just about the last 2 weeks, we're seeing a decrease in the amount of positive cases. So that article might have gathered data from a few weeks back. I don't know. So again, I'm sorry. I will definitely bring this back to our data team. And I know that there is some difference between the state's data and our data in terms of when it's collected and given to us to add to our data. So if the state is providing some data, maybe it hasn't been produced to us yet. And so there is sometimes a lag in information. So I think I will definitely bring this article and this information back to our data team so that they can help sort of figure out where the discrepancy is.
I'll forward the article to you.
Okay.
Thank you.
So maybe
I just want to mention, I know I have some questions on the board members too. And once we're done, there are also some questions in the chat, just FYI. My question was, in regards to the increase in the 10033, there's no one event in particular that's related to, right? I mean, obviously, I know a lot of the uptick in Wisconsin and North Dakota is based on some bike rally. We didn't have that. But was there any event that you're aware of that?
So yeah, I don't know. We don't have that information, which is why I asked if you all are aware of anything happening in your neighborhoods, right? If there's this one particular place where people are hanging out, or if there's one building where no one's wearing, face coverings. If you all know and you're on the ground and you live in the neighborhood and you see things that are making you uncomfortable and could potentially be creating a situation where there's an uptick in cases, please let us know, because that's where we can deploy resources to, whether it's educational materials, whether it's actual face coverings for folks to wear.
Well,
it's
I would
really
say
important.
I would say just one thing I noticed, and it was probably about 2 weeks ago. I live around the corner from Bennett Park, and Bennett Park is often during the summer has parties, little birthday parties or showers or what have you. And I hadn't seen one in a very long time, but then I saw one a couple weeks ago. So I know, that area, there's stationary picnic tables that people like to at least gather at.
Yeah, and again, when it comes to outdoor spaces, I think typically we're like, outdoor spaces are okay as long as people do continue to do their social distancing and wearing face coverings around folks who aren't your immediate family members who you've been in the same household with. But if you're having parties, birthday parties in the park, I mean, that still, could elevate the chances of transmission to that group of folks. So it's really, again, just a matter of behavior and, encouraging everyone to just continue to follow the guidelines that have been set forth because they have been doing us pretty well so far, up to this point where we are now seeing these large gatherings. We're seeing, like venues where they're having parties indoors with no face coverings. I mean, this is really across the board. It's not one particular group. It's really just we all have to remain vigilant and diligent and disciplined about it. And, we don't want to revert back to the beginning where everything had to be shut down because I don't know if folks can deal with that much longer. So, yeah.
This might, can you hear me? I don't know if this has already been covered. But in Inwood Hill Park, there's been very little mask wearing, very little social distancing. And this has been throughout the summer. I mean, I wouldn't say it's worse than it's ever been. It's been pretty bad since the beginning. We've made some efforts to hand out masks in the park and to educate people, but I mean, basically every weekend it is just a super spreader. And so I think deploying specific resources to that park where the message is not getting through.
Yeah, that's really helpful information. So definitely I can let the mayor's office know. Through the mayor's office of special enforcement, it's a group of city inspectors from multiple agencies where they're being asked to do this work to go out to educate folks, but also to do, the indoor dining inspections, the outdoor dining inspections, making sure that everybody is following these social distancing guidelines. So, anytime you're hearing of a location that could be a hotspot, I encourage you to email Steve and he can let me know or email me directly. I left my email in the chat so that I can let the mayor's office know that this is happening and that we need to direct and divert resources to those locations.
Hi, it's Tanya. I had my hand up. I didn't. I was gonna wait. Should we just jump in, or do you want us to do? You want to wait to acknowledge? I don't want to just jump in if you don't want that. So,
Wait, Sally, you finished?
Sure.
All right, so Tanya, go ahead.
I wanted to ask you two things. One, I wanted to ask you, Pauline, and thank you for being here and sharing this information. We really appreciate you. What will be your protocol? Like once, let's say we let you know, right?
Mm-hmm.
What is going to happen after that? Like, what are the steps that you're going to? I just like to know what the process is in terms of outreach, in terms of what you do once you get this information, and then two,
Sure.
and
Oh,
then
sorry.
two is no problem, no. And so two, is there a way? Because a lot of times, what I know, what I'm running up against, and what some people, other people running up against, is accusations of targeting people, right? And so we want to make sure. I see a lot of gatherings, by the way, lots of gatherings, and where people are not masking up. I mean, it's just chronic. And I'm concerned about the house parties. Once it gets cold, it's too cold for them to gather outside. They're going to take it inside because that's what was happening. That's what always happens around here when you have these large indoor parties. So are you all going to get ahead of that? What we call it messaging, where it's not the community being accused of targeting people. Is it going to be, how are you all going to get ahead of that messaging? Say that this is that you all are asking people to do this, and so I yeah, Those are my
Yeah.
two questions.
Yeah, I think those are two very valid questions. So the first one in terms of process, what we've been doing is once I or like a member of our team who covers, external affairs for the office, if we get a complaint, we're asked to forward it over to the mayor's office of special enforcement and the mayor's office of community affairs. That way they're aware of what is happening on the ground. A lot of times it's easier when it's a restaurant that is creating an issue because not only do we have resources, but the state has had resources allocated for inspections of those industries, right? So for restaurants specifically, there's the power of the SLA and there's, specific dedicated folks from the state and the city who could be deployed to do inspections and issue fines and do all of that and take away liquor licenses if they are creating a situation where people are gathering and they're not following any of the guidelines for reopening. When it comes to knocking down doors in people's homes, I don't know if that's going to be something that we're going to be able to do or even want to do because that just seems like a little bit of an overreach. I mean, this is just me speaking personally. I just don't think that we would have the capacity to go to individual house parties, but what we could do would be to work on educating specific demographics. And so earlier on in the summer, when we were seeing young folks going out and going to sidewalk bars, we really did focus a lot of our outreach on that population and the younger folks through Twitter, through social media, really getting that messaging across that just because they're young and just because, the impact to them may not be as harsh, they still have that responsibility to protect themselves and to protect other people. And when it comes to this particular situation where we're seeing clusters in certain neighborhoods, we're dedicating those resources to those neighborhoods and we're really trying to figure out specifically what people are saying on the ground level. And we're coming across a lot of people reluctant to get testing, whether it's because they are still afraid of test and trace and having contact tracers call them. People are very fearful of law enforcement. And so we want to make that messaging very clear that none of your information will be forwarded to ICE. Just because you test positive for COVID-19 doesn't mean it's going to impact your citizenship path. I mean, all of these things we have to combat because rumors are rampant. And the fact that social media is so accessible and a lot of people don't trust, government, they get their information from all these other places. And so it's like a double whammy. We have to get regular information out, but then we also have to figure out where the rumors are, what they are, and then combat those on the level in which people are receiving information. So there's always pockets of folks who are very disenfranchised from government who will never hear what we have to say. And so we really need to depend on our community partners and trusted leadership in the community to help us get that information and education out. So again, if you all have specific leaders, people like faith group leaders or, tenant leaders, people in the community that people really trust, give us those names so that we can add them to a list of advocates who we can reach out to share this information and to help us reach those really disenfranchised people, because we know they're never going to go onto DOHMH website and get this information.
Well, I think
Thank you.
I think the next speakers on the agenda, I think could also help us address this point. There with the Northern Manhattan Improvement Corporation. Do we have any other hands up from committee members? All right.
There's a Mr. Grobman on the
Yeah,
chat
yeah.
that would like to ask a question.
Yeah, please. Can you
He
Yeah.
should be able to unmute himself, I believe.
Yeah, I'm unmuted. Can you hear me?
There you go.
Okay. I just wanted to ask this question because what I've seen up here, you're talking about SLA and enforcement of existing licenses and legitimate businesses. But what I've seen up in this neighborhood are parties that are just on the sidewalk. There's no license, there's no nothing, and there is no social distancing and no mask wearing. And it's been going on. I mean, there are other issues involved besides the COVID thing as well, and none of those issues get addressed. And I believe that something has to be done about that. It could, about that particular situation, because we're talking about something that SLA or any of the Department of Special Enforcement, they can't do anything about that. There is no license to take away from these people. They're sitting on the street drinking and yelling at each other with no masks on, and it's been going on all summer long. And I think we've just been lucky that we haven't had some kind of a flare up at this point. But once a little bit of COVID gets around and gets into the population with those kind of things going on, it's going to spread like wildfire, as far as I could see. So something has to be done about that, whether it's education, whether it's some kind of law enforcement, whatever it takes to try to keep everybody healthy, and that's all I'm going to say about that part of the issue right now.
Well, I think Bernard, you raised a very good point. But Pauline, do you have anything you'd want to say in response?
Yeah, no, I absolutely agree. I think the complication is just finding that right balance between utilizing, law enforcement, NYPD, to regulate something that isn't a law, but really just guidance and regulation. And, over policing has been a problem in many neighborhoods, and we don't want that to be an additional issue to plague a neighborhood, right? So I think finding that balance has been that the city is working really hard to do. But your point, Bernard, is very well taken, that there are certain pockets of the population, whether it's a specific age group, whether it's just people who don't believe that COVID is a thing. I mean, this actually happens where people are just they don't care what they're, hearing on social media goes counter to everything that we as a public health agency is saying. So we are trying to combat all of those things. And I think it's a matter of education, like we said, but really trying to identify those leaders in the neighborhood that can really get through to that population. Right? Like I mentioned, certain folks are never going to listen to what the New York City Health Department is going to say. And so we really need those partners.
We're not talking about young kids either. We're talking about 30, 40, 50-year-old people.
Right.
And they have jobs. They work, they're like sort of like regular people, but they are on the street, not wearing masks, closed up, drinking. The drunker they get, the closer they get, the more they yell.
Yeah.
I mean, we're playing with fire with this situation.
Yeah.
It's going to stop because of the weather, but there might be nice days where they'll still be out there doing it, and then maybe they take it inside. I have no idea about that, but
Bernard, let me move.
Yeah.
Thank you. Let me move on.
Well,
And did I notice?
Can I speak?
What's that,
Steve,
Bob?
Could I speak? I don't see where you can raise your hand on this Cisco system. Could I make a comment?
Yeah, go ahead.
Okay, I would like to ask, I mean, the point Bernard makes, and which certainly Tanya has been a leader in, is that this excessive noise is a health problem. And I would estimate that probably...
If you get the door there for me.
Yeah, and so I really want to say that I estimate that probably 75,000 people in our neighborhood have been robbed of effective sleep and rest since approximately April. So I would like to know, how much would it cost, or could we investigate that the police, the 34th precinct, the patrol cars be supplied with effective decibel meters? Because one thing that holds them back from actually issuing summons or dealing with this problem is that they have to have effective decibel meters so that they can say, well, this is a violation. So
Okay, I would ask that you hold that thought until we get to the budget priorities later on the agenda.
Because I would say that would be a good thing.
Oh, yes, okay.
And Mary has a question.
I'm sorry,
Sure.
who does?
Mary Anderson.
Okay, Mary, go ahead.
Thank you. I, uh, there was talk about, regulating the noise and all of that with the outdoor dining. What I'm seeing at almost every restaurant that has outdoor dining, the tables are on top of each other. There's no way they're 6 feet apart. There's no social distancing at all, and nothing is being done about it. My understanding was that DOT was supposed to be regulating this and doing inspections to be sure that they were complying with this regulation, but it's not happening. And I wondered if, the Department of Health is able to do anything about that or work with DOT, or I don't know.
Right. So, I mean, that again is being coordinated under the Mayor's Office of Special Enforcement, where again, like I mentioned, they are bringing inspectors from every agency across the board to be dispatched out to do inspections for restaurants in particular. So, any restaurant can get an inspector from buildings or from FDNY or, any city inspector who has been trained to do inspections for outdoor and indoor dining could be dispatched to any location. So it's not just DOH, MH inspectors, but when it comes to restaurants, though, they're still subject to their annual inspection, which we are resuming. And so that annual inspection where they get the letter grade, that will only be DOH, MH inspectors. And those inspectors have also been trained to see if there are any social distancing guidelines that are being violated. So, I think restaurants are at this point being pretty regulated, but we do hear of restaurants that are pushing the boundaries a little bit, and of course we would love to hear that so that we can let the mayor's office know.
It's not even a little bit, and it's almost every restaurant in my area. I'm in the Heights. I'm on 172nd.
Okay. I mean, that's useful information for us to be able to share with them so
If you
that they
walk
can
up Broadway from 172nd, every single restaurant has outdoor tables, and there's one or two that are okay because they're only able to put like 2 tables outside. But the ones that are able to put, a lot of tables outside, they're on top of each other.
Okay.
And then they're going to be more enclosed because they're going to be allowed to put tents around. So, all of that coughing and breathing and whatever that you're already on top of each other is going to be exacerbated.
Okay.
Understood.
All right. Anyone else from the committee or the board? I think there was a Rajiv who, Darren, are you checking the chat?
Oh, and Cheryl would like to ask a question, I believe.
Cheryl Miller?
Cheryl Miller.
All right. Can you unmute her or?
I think she
Hi,
should be
can
able to.
everybody hear me?
Yes.
Okay, so in regards to what Pauline was just saying before about elected officials doing outreach and trying to educate people in the neighborhood. Okay, so I just wanted to say that I had called Mark Levine's office last week, I believe it was. He's my council member. And I raised this issue. And what one of his staff told me is that he is trying to pass some kind of legislation to enforce this more, because his representative told me that he has reached out to the community. He has done outreaches. He's talked till he's probably blue in the face, and that there are still people that are just outright being obstinate, and they just don't want to do it. They just don't want to wear a mask, and they just don't want to social distance. I live on West 165th and Broadway, and when I go to the grocery store, from my house to 160th and Broadway, I see so much stuff that it's ridiculous. Bernard was saying before about people screaming in each other's faces. And I see this every time I go down to 160th and Broadway. I see people right in each other's faces, screaming, yelling, talking loud. One person is smoking and blowing the smoke in the other person's face that doesn't have a mask on. So, it's not that the message is not getting out. People know. Governor Cuomo had said yesterday that this is already now beyond just handing masks out to people. He said, we've been doing this since February. Now it's time for the local government to enforce. And he said, if Mayor de Blasio, he didn't mention his name, but I know that's who he was talking about. If he doesn't want to step up to the plate, Governor Cuomo will take over. because he's not going to have another issue like what he had before. He's not going to want that. And he's getting very aggravated.
All right.
So I just wanted to mention that.
All right. Thank you, Cheryl.
Sure.
Anyone else? All right. Wasn't there a Rajiv who sent a message saying he wanted to ask something?
Steve, I also wanted to give a comment.
Steve, I just want to point out, it's 6:50.
Yeah, okay.
We need to move briskly through the rest of this agenda. We haven't even got to the meat of this.
Okay.
I'm sorry. I'm sorry.
All right, Julio.
Thank you, Steve. I just very brief. I just wanted to thank Pauline, Department of Health. We're in the process of organizing annual flu shots with elected officials and community-based organizations. And so we met with DOH, thanks to Pauline, to sort of align and share information of when these events are taking place so that our community could be better informed when these events are taking place, and educate the community about how important it is to get the flu shot this year, especially as we have two different pathogens, the flu and COVID converging. So we're, again, just want to thank Pauline for that. The city has also generously offered to provide some vaccine for our program, and we're looking to see where that's possible. So again, thank you, Pauline.
No problem. Thank you. And please just let me know. Feel free to email me directly or email through Steve all of the places of concern, and I will definitely reach out to the mayor's office. And maybe we can work together on a day of action where there's dedicated resources to your community specifically, so that we can get that information out there and really change minds and hearts and hopefully get people to behave a little bit better. I appreciate it. Thank you.
Okay, that's a great idea. We would love to work with you on the day of action. I would love to see that happen. Very good idea. All right, thank you, Pauline. Again, we'll see you same time next month. Next, we have the two resource navigators from the Northern Manhattan Improvement Corporation, Aldinas Beto and Taina Moreno from the Test and Trace program. I see Aldenice is Taina with us too?
Yes, I'm here.
Oh, very good.
No,
All right. All right. Did you choose up to see who's going to go first?
Yes, I'm going to share the screen. I hope
very
that
good.
it works. Okay. It's my first time doing it on WebEx. Okay, you guys can see it, right?
Yes, I can see.
Yes.
Yeah, I can see it as well.
Okay, perfect.
All right, so
The presentation can be. Trying to make it bigger, but okay. There goes.
okay, awesome. So hi, my name is Aldenice Beto, and I'm a resource navigator working with UNIC. And I just want to say that we have been looking forward to this meeting and having the opportunity to share some details about this program and what it is that we do.
And hi, everyone. I'm Taina Morero. I'm also a resource navigator, working with the Test and Trace program for NIMIC. And thank you so much for inviting us. So we'll get started so you guys can learn a little bit more about what we do. All right. So what is the Test and Trace program? So it's a public health initiative to fight COVID-19. So that way New Yorkers can get back to school, back to work. So that way the businesses and other organizations can reopen safely. The core is a group of doctors, public health professionals, and community advocates working to reverse the COVID-19 outbreak and protect our city.
Okay, so how does the initiative work? The first step is to get a COVID-19 test. If you test positive, you're automatically referred to the program. The second step is you'll receive a call from a contact tracer, and they're going to call and find out who you've been in contact with. The third step is to take care. This is when you'll receive a call from a resource navigator whose job is to identify the client's needs during their isolation period.
Right. So when you go to the website, New York City Gov /COVID test, you can, tell everybody, your neighbors, that they can get a free test. And every week there's different mobile units. So they're always changing, but they usually have a few in each borough. And pretty much, if you have COVID-19 symptoms, if you've been in contact with a confirmed case, or if you know anyone who's working in a nursing home, a shelter, or adult care facility, they should definitely go and get tested. And all the tests are free, confidential, and safe, and doesn't matter about immigration status. Okay, so when it comes to the tracing part, the contact tracer, it's very important that when people see a phone call, and I know you guys mentioned it earlier, when they see a phone call that says NYC test and trace, that they pick up the phone, because most likely it's a contact tracer calling them to share that they've been exposed to someone who has tested positive for COVID-19. Okay. And then once they do that, they're going to do an intake. And with the intake, they're going to ask them all of these questions on who have they been with the past few days, so that way they can reach out to them as well and collect intake for them. So we've been having, that department's been doing really well with, reaching out to people and getting in contact with the contacts and just, making sure that they're staying home.
So like I mentioned, take care is the third step. During your isolation period, you'll have a choice of staying either at home or at a hotel. And like I mentioned previously, this is when you'll receive a call from a resource navigator, and the purpose of this call is to find out what the client needs in order to stay safe and comfortable during their isolation period. Our most asked for resources are food, medication delivery, and help paying for their utility bills. Additionally, now we have access to NowPal, which is a website that helps us find almost every resource available and offered in NYC. And it has been a great tool for us because it allows us to send all the information directly to the client's phone. And it also makes our calls with the clients shorter, which has been great for them and also for us to be more productive. Also recently, the Test and Trace Corps introduced Take Care Kits, and these Take Care Kits are sent to the clients. And the package includes enough personal protective equipment for a household of 3 to quarantine for 10 to 14 days. This includes a medical grade mask, sanitizing wipes, hand sanitizers, a thermometer, and a pulse oximeter to help those who test positive for COVID-19 to monitor their oxygen levels.
Right. And then we also have been referring the NIMIC hotline. So if you guys don't know about NIMIC, we offer a lot of services from housing. We have a food pantry. The most common one that I feel that we've been helping with has been the benefits line. A lot of people have, been staying home, or they haven't been working for many months. And some people don't qualify for unemployment. So what we'll do is refer them to, we give them the HRA, Human Resource Administration hotline, so they can call the application, or the website, so they can do the application online. But we also have them call the benefits hotline, and even stuff like for immigration, we have certain days where they can call and speak to someone, and then they can ask questions to see if they're eligible to apply for the benefits that they're seeking. And just a few facts about the program. We only had 10 minutes, so we didn't want to take up too much of your time. We do have a video on the Facebook page that goes into a little bit more detail, so that way you guys can look at it later. But yeah, so we started this test and trace program with NIMIC on June 1st. Right now we have a total of 4 resource navigators on our team. And we do work Sunday through Saturday. So 7 days a week, from pretty much 9 in the morning to 9 at night. So we are out there as soon as we get the referral that someone has been contacted. We call them if they want resources. We call them right away the same day. And like I said, so 9 o'clock at night. If we don't reach them, then we call them a few times to try to get in contact with them. And right now we've helped about over 1,500 people since the start of the program. So that's about 45% who live in the Inwood and Washington Heights area. Most of the clients that we serve in that area, a few in the Bronx, and then occasionally we get Queens, Brooklyn, and Staten Island when we help out other CBOs.
Notice that most clients appreciate the daily check-ins and always being connected to the resources that they need. For example, we have clients that don't require any resources, but they just need someone to talk to or someone to answer questions for them. I've even had calls that the whole time, well, most of the time, I'm just listening to their concerns. I've had some clients that they live alone, and most of their family are out of the state. So apart from, helping them connect to physical resources, I think part of our job is just to help them with emotional, support in general. And it has been like one of the most gratifying parts of our job.
Right.
And I guess now we're
So
gonna move on to the questions. So we're gonna try our best to answer your questions. So yeah.
All right, so, okay, so Denise to Taina. So you're not doing any of the tracing. You're doing the follow-up step afterwards when people are isolated. You're reaching out to to them to see what they need to make them so they'll be comfortable and have
right.
and have the ability to handle being by themselves or being isolated for 10 to 14
Exactly.
days.
Correct.
Okay.
Yeah.
So I
Yes,
didn't know.
that's correct.
Okay, so now I understand what's meant by the resource navigator, and so really there's no reason why anybody should resist talking to you because you're not asking them to disclose any private information or there's no reason for them to be fearful of talking to you because all you're doing is giving them help, right? Is that correct?
Correct. Yeah, we give them
And it's
isolation
definitely-
tips and help. I'm sorry,
Yeah, and
Lilith,
it's
you can go.
confidential. We don't take into account anyone's like immigration status or nothing like that. We don't ask those kinds of questions.
No, but so it would, right, so
yeah.
it would make sense. It would make sense that whoever you reach out to is going to be responsive because you're just you're not asking them to disclose anything.
Yeah, I mean,
Correct.
some people be hesitant at the beginning. I think once we start explaining a little bit more about our roles and what the purpose of the call is, they do start opening up a little bit more to the idea of having someone help them during this time. And I think just in general, some people aren't open to the idea of receiving help from anyone that they know.
Yeah. Right.
So yeah, I think us being strangers helps in a way.
Right.
Yeah, so most of our clients are definitely open to receiving the resources available.
Right, and they also just to clarify, the contact tracer actually calls them every day. So sometimes they'll tell me, "Oh, well, I already spoke to someone from your department," but I'm like, "Well, I noticed that you requested resources," and they're like, "Oh, okay, yes, no, you're right. This is something different." So they call them every day just to monitor their symptoms and then give them the okay when they can leave their home. Where our job is while they're home to make sure that they stay home. Like if they need food, we'll send them food, medication delivery, some people need diapers, things like that. So that way they don't leave their home. If they can't afford to buy it, on websites like Instacart, we've found free delivery services. There's a lot of nonprofits that have started that are giving, have volunteers that are doing the grocery shopping for absolutely free.
But you don't have tracers, or do you, at NIMIC? Are tracers? Are there any tracers? Okay, all right. All right, now I understand what your role is. I didn't know that before. That's great. Okay, are there any questions from committee members? From any members of the board or the public? Daryl, are you checking the chat?
Hold on a second.
While we're doing that, I just want to thank them for doing this work. It's very important work. This is Tanya from Community Board. Thank you for doing this work. It's vital, and we, helping people feel safe and secure and confident. I know it can be scary coming down with this, virus and people who are alone. And so thank you for all of that. So yeah, that's all.
Absolutely. Yeah. Thank you for the acknowledgement.
Yeah, that's right. Yeah, I think Tanya makes a good point. I mean, you must be playing an important role just to reassure people that that they're going to be okay, that they can survive this ordeal.
Right. They are stressed
Especially at the
sometimes.
beginning. Yeah, I remember at the beginning of it all, at the beginning of this program, a lot of my calls were very like emotionally driven. People were just honestly scared. They felt alone. They were in complete quarantine. So if you take all of that into consideration, and then obviously receiving a positive test result, it was a lot. So definitely, I think our job has been very important during these times.
Daryl, do we have anyone else in the chat?
No, there was no questions in the chat.
All right, very good. All right, Taina, Denise, thank you so much.
Thank you, everyone.
Thank you.
Could you email the PowerPoint to me, please?
Absolutely. Let me try
Along
to,
the Facebook video, so you guys can have
I'm
any
sorry?
information if you want to look into that.
I'm sorry, Denise, what was the last thing you said?
I mentioned that we'll also send along the link to the multiverse video that Zaina and I put together in case you all have any questions. They're along, yeah.
Thank you so much.
Yeah.
All right.
everyone.
I think there's a kid that wants to get in on the action here. I don't know where that's coming from.
Hey, Janelle, you with us? Janelle Edwards?
Yes, I'm still here, Steve.
All right. All right, Janelle is the Community Affairs Associate at the Columbia University Irving Medical Center.
Hi, everyone. I hope you're having a great evening. I'm sorry you can't see me. I'm having technical difficulties. But any information that I share, I will be sending in a follow-up report to Steve, and he can then disseminate the information to everyone in the committee and to the wider board. So my report is very brief. I'll start with an upcoming event we're having. On October 14th from 5 to 7, we're having the CYMC Election Forum. We've invited a number of panelists and a number of students from every school to ask what are the most pertinent and relevant questions that voters really should consider in regards to the upcoming election. This is nonpartisan, and we do have experts from across the aisle to provide a balanced or a wider range of viewpoints. And we're really expecting it to be a great event. Again, it's October 14th from 5 to 7. It'll be on Zoom. You can register or watch the live stream online. Really quickly, the URL is neighbors.columbia.edu/CUIMC election. I'll also send that to Steve in a follow-up along with the flyer once it's been finalized.
All right, are you going to make sure? Are you going to make sure that the person who speaks for Trump doesn't keep interrupting the speaker for Biden?
Well, I see you actually watched the debate, and we don't have surrogates from the campaign as we did in the past. Yeah.
Oh, okay.
We just have people who.
Good. That's much safer.
Okay. Yes, it is, but I'm not going to get into that. But they're not campaign surrogates. It's just.
Can folks mute if you're not speaking, please? Thank you.
We're inviting health policy experts to shine a light on the issues that
Okay, that's much better. Very good.
Yeah. So even balanced, helpful, and hopefully informative discussion, and the public will be invited to ask questions as well.
Okay.
The second update, Steve had asked about some information. So we weekly across Columbia University, there's information available on who is being tested, or rather the numbers of who is being tested across all campuses. And that information is found at covid19.columbia.edu. Again, covid19.columbia.edu. So as of the week of the 21st to the 27th, approximately or exactly 2,988 people were tested across all campuses. And at the medical center, 608 people were tested, and there was one positive test. That information is updated weekly. I am not in charge of that, so I do not have access to the numbers, but this is publicly available, and you can see all the way back to June, the data there.
And I'm sorry, Janelle, the 608 were tested during what period of time?
From the 21st of September to the 27th. That's the most recent data that's available on the site.
And there was only one positive case?
Mm-hmm. Only one positive.
Okay.
That's
All
it
right.
for me. If anyone has any questions or concerns, feel free to
All right.
let me know.
All right. Are there any questions from the committee members? Any from the board members? Anything from the public? Darren, do we have anything in the chat?
No, we do not.
Okay, very good. All right, thank you, Janelle. You're
Thank
gonna
you.
you're gonna send me something?
Yes, I will. I definitely will.
All right, thank you.
All right, have a great evening.
Okay, bye.
Bye.
Okay, next is the report from the Isabella Geriatric Center, Betty Lehman, Director of Marketing and Communication.
Okay, hi, everyone. Can you hear me?
Yes.
Can you hear me? Okay, great. We are stable at Isabella in the sense that we have had no new cases of COVID. We are screening all staff members every day and testing everybody once a week for COVID with the nasal swab and all. So any employee who works at Isabella is tested once a week. We maintain a hotline for anybody with any family members who have relatives at Isabella. We are maintaining a hotline where family members can call in and get status reports on their loved ones. It's a hotline that is staffed by social workers who are able to respond in an intelligent manner as to the status. We are also providing window visits, which are scheduled for periods of half an hour for family members who want to visit. With the oncoming cold weather, we are investigating, obviously, the potential of moving those visits inside. But that's going to really depend on the regulations that are provided to us by New York State and the federal government. So we're very closely adhering to whatever the state and the federal government determine would be appropriate. Our community programs continue to function, but in a remote manner. We have three Northern North programs, retirement programs in the community. We have a senior resource center, which provides benefit counseling, and we have the Upper Manhattan Partnership for Senior Independence. All of those staff members are working remotely and are in touch with their clients through telephone calls, etc. What else can I tell you? We have enough equipment for our staff. We continue to monitor that because we're required and do make sure that we have enough equipment, not only for now, but much of it in the event potential of an uptick in COVID in the community that requires more admissions to the nursing home. So we're very prepared for that. And that's it. I will send you a report, Steve, so you can.
Yeah, the connection was very strange, so I'll need the report because I didn't pick up on everything. And I do want to point out that, I've been checking the state health department reports, and the latest one from yesterday indicates that, as you mentioned, there have been no additional COVID-19 cases at Isabella since the last report from about 2 weeks ago that I checked. So,
Yes.
I guess things are hopefully returning to normal. And what is the? I can't believe I forgot the name of. What's the name of the program that you have in Mitchell Lamas for the senior citizen communities? Yeah.
Norks.
Norks. Thank you. Norks. Yes.
Naturally occurring retirement communities. NORC. Yeah.
Are you still conducting that program?
Yes, we are. We have social workers and nurses and so forth. What we can't do is the in-person visits because of COVID, but we do stay in touch with all of the clients through the telephone and the computer, and WebEx and Zoom and so forth. So we're doing the best we can with the technology.
Yeah. All right. Any questions from the committee? Any questions from board members? Do we have anything from the public?
None in the chat, no.
Nothing? Okay, thank you, Betty. All right, we're up to our discussion about the FY '22 budget priorities. I sent to everybody last year's list of FY '21 priorities. Last year we had 10 expense budget priorities. And we had four on the capital side. So I know we could go through them one by one. The first one for the committee and which also became the first one for the board as a whole was to expand mental health services in the community, including the crisis intervention and acute care for persons with severe mental illness. And I think Mary Anderson wants to speak on this topic.
You're absolutely right. I heard you from the other room. I said, this is my cue. We actually talked about this in our committee this morning, and we were in agreement to leave this issue on your budget, with the hope that you would add a statement, something that we came up with, or something similar to it, so that the seniors would be included in this mental health need. The addition is especially seniors whose mental health and social engagement have been adversely impacted by COVID-19.
So you can email that to me, right?
Yes, I can.
Okay, but do me a favor, say it one more time, especially seniors.
Sure enough. Especially seniors whose mental health and social engagement have been adversely impacted by COVID-19.
That sounds pretty good to me. Can I hear what other committee members think about that?
I agree, Mary. Thank you for including other populations, and I think definitely COVID. I was going to say the same thing. Thank you, Mary. I was going to say, can we include COVID and mental health around COVID because people have been isolated? I do think yes, seniors, but also others who might be impacted by COVID. We had the doctor who committed suicide.
Right.
Right. And I'm not trying to be that person that says, but what about, you know what I mean? I'm not trying to be that person, but I'm just saying that, other people are also being impacted. So maybe we can include a way to. Mm-hmm.
Mary, you don't have a problem with that, do you?
I'm sorry?
You don't have a problem with that, do you?
No, as long as we, add seniors in there as well, because.
Okay. All right. I hear that we have a consensus on that point. Okay.
Yes.
Steve, why don't we change it to those to COVID-related stress and isolation?
Well, I don't know how many words were allowed, but I'll fit in as many as I can.
Wait, and Kathy said grief counseling. I think that's really good. She put it in the chat. The grief counseling.
What kind of counseling?
Grief counseling. Kathy put that in the chat.
All right. Okay. I guess my comment, Steve, this is Sally. Yeah. I don't know how to raise my hand. I think this is Sally. I don't see how on WebEx to raise my hand, so I apologize.
Okay. Go ahead.
The needs for mental health services are for all populations. I think the people with severe mental illness are probably the most impacted because they have not had access to inpatient care. So I would not want to elevate one population over there. I think that maybe if we had something to say, especially in light of this significant challenges posed to all populations by COVID-19, rather than point out specific populations. Because I think it's happened with the elderly. I think it's happened with school children. I think it's happened with families that don't have support services. I think it's pretty much across the board. And I worry by favoring one population over the other, especially given that I work with people with severe mental illness, and that is desperately in need.
I'd like to work in some. I'd like to be able to acknowledge the work of our fellow committee. So I would like to let me try to work on this. And by the time of the general board meeting or the public, we have a public hearing which I think has been scheduled
Right.
for 2 weeks from now. We'll come up with some language, hopefully that you'll find agreeable.
Okay.
All right. Any other comments on this one? Okay. Number two. Excuse me.
I have something else I just wanted to add. I agree with Sally because I'm a retired psychiatric nurse, so that's who I worked. The acute population. But the problem is that seniors have not had sufficient mental health services to begin with. In all these years, we've been trying to get some mental health services specifically for seniors. So we really want to get that addressed in this. It's even worse. It's even worse now. There are more people impacted, more seniors impacted.
Yeah, I'm gonna work it in here. Okay. Our number two priority was to increase. Hello.
Yeah.
Okay. Number two priority was to increase substance abuse services, including opioid overdose prevention education and funding for syringe cleanups and collections. I found it interesting when we had the EMS presentation last month that the EMS captain told us that during the COVID-19 epidemic, there had been a reduction in overdoses in our area. Who's to say how long that'll go on for? But are there any comments on what we should do about this one?
I would say we keep it because I think the problem is there. I just, we still don't have the inpatient facilities that we need.
All right. Well, this would really, I think, address outpatient situations. But okay. I don't hear anyone objecting, so we'll keep it. Number three on our list was to increase HIV/AIDS prevention and treatment services and LGBTQ services in our community. This was number 3 on our list and number 13 on the board's list.
Steve, I would like to move up. See if we can move up. You see the number 8 with the trash?
We didn't get there yet. Hold
oh,
that
I'm
thought.
sorry. I'm sorry.
You're not allowed to jump ahead.
Okay. See you later.
Okay. I want to jump that one ahead, yes, but not yet. Do you want to say anything about HIV/AIDS?
Keep it.
All right.
Keep
what
it.
was that?
Keep
Leave it?
Keep it.
Okay.
Yes.
Keep it. Okay. Number 4 on our list and number 11 on the board's list. Increase services to prevent and treat chronic diseases such as Alzheimer's, diabetes, cancer, and heart disease in our community. Any comments on this one?
Keep it.
Okay. Who said that?
Kelly.
Barbara.
Who?
I think that all the non-COVID illnesses are as important, if not more important, because
Okay, very good. Okay, but Barbara wants us to keep it.
Can we include and I don't, maybe we haven't gotten there yet, but how those who've had COVID and will have long-term effects from it. So maybe just adding that in there.
And also, Daryl, but because of COVID, people are more susceptible who have some of these conditions. People who have diabetes, heart disease, I would even say hypertension, which I think should be included in here that we left out. But I think hypertension should be included. But those are things that make it susceptible. Maybe we can include that language. It might help them to move it up on the overall ranking. I don't know.
What did you just say we should add? Hypertension?
Hypertension, yes.
Okay, very good.
Well, and this is all like COVID, as well as COVID.
COVID is not a chronic disease.
It's not, but I think there's people that are going to be suffering from the impact of it for a long time. they need services that don't currently exist.
But it also makes you more susceptible to COVID, though, if you have some of
Exactly.
these conditions. And I think maybe we should
Absolutely.
say that,
Mhm.
you know?
Yeah, but we could do, we're allowed like another 25 words to explain the request. But maybe what Darrell is bringing up should stand on its own as a separate item, because it's really a new thought that special services are needed to deal with people who are recovering from COVID.
Okay, then,
That works too.
then use the phrase that increased susceptibility to COVID.
Excuse me?
Then you could use the phrase that increased susceptibility to COVID.
Conditions that increase susceptibility. Yeah.
Yeah, that's a good one. Okay, but that would go into our existing item. But
Correct.
should we have a separate one that just talks about providing services to people recovering from COVID?
But
that sounds good.
You know, that's putting in a very long list, and the shot to get things ranked high is to not have such a long list.
Yeah, that's true too. Okay,
So
well, let's keep. All right,
say, I would incorporate it into number 4.
All right, let's keep going. Number 5, which was number 20 on the board's list, was to provide funding to ensure that all local public schools have health clinics.
Well, since the schools are closed, I would downgrade that for this year.
All right, but I don't want to lose it though.
Schools are reopened.
Well, yeah, not so much, not so much.
Isn't the promise that
my friend's
the promise of that is already happening now?
Yeah, I would keep it on. Keep it on, but put it lower.
Well,
No, I'm just saying, isn't the promise of that already happening in progress or no?
No.
I don't think it is.
Okay.
I think.
I want to say,
I mean, I heard about nurses and social workers, maybe not clinics like we say.
I think it's still a priority of the borough president, but I think it's not yet been accomplished, and I think it is important to keep it on.
Is Julio still on the call?
It doesn't look like it. No.
No. Okay. All right. Number 6 on our list. Number 17 on the board's list was to increase staff to conduct regular noise enforcement, air quality monitoring, and water quality testing.
Yes, and then that one I would for number 6, and provide funding for decibel meters to the NYPD, to the 34th and 33rd precinct.
Wouldn't that be on the public safety request list?
We can do it together with them.
Yes. You know something, you're right. Who said that, Sally?
Sally.
Yeah, but we can do that together with them because you cannot do noise enforcement without a decibel meter.
So, but Steve, you'll talk to Curtis to see who should get it.
Yeah, he has to get it because it's the police department that would have to buy them. It's a budget item for the police. Okay, very good.
We're the first ones to meet this month, so
that's true. Very good.
Well, I would like that wording in there so that it doesn't get lost, and I don't see why.
We can't put it in. All Steve is saying is that he will make sure that it's in Curtis's because we are not allowed to request that.
No. Okay, number 7 on our list and number 23 on the board's list is to increase pest control efforts to eliminate rats, cockroaches, etc. in our community.
Move it down. Move it down.
Move it down. Okay.
I say up. I want it ranked high.
Okay.
I think it's
everywhere.
I know, but I think it's become a bigger issue and will become a bigger issue with this outdoor dining.
Yes.
Yeah. Okay.
I want it in the top 5. Top 5.
Well, okay. Well,
can we talk about the specific ranking after we finish? Maybe.
Yes.
Steve, I have a question on that item. Sorry. Are raccoons are included in that?
No.
Okay. They're native species.
Got it.
No, they're not considered pest control. But did you see the story yesterday that we're now doing a special birth control effort with raccoons?
No, but I'm glad to hear it because I have to duck and dive them all the time.
Yeah, we're gonna be throwing little packets that look like the ketchup packets in forested areas where we know raccoons hang out, and hopefully they're gonna eat them and they're gonna be sterilized. You may end up seeing fewer raccoons. Where was I? Pest control. Okay, this is one, Barbara. I don't care what you say, Barbara. This one belongs in the top 5. Increased trash basket collection on commercial streets on weekends in District 12. Actually, I don't want to say weekends anymore. I want to say every single day.
Yes,
I agree.
I want this to stop where they only put trash baskets supposedly on a commercial street. So for example, there would be none on Bennett Avenue, none on Seaman Avenue. That's wrong, wrong, wrong.
Could we also add something about recycling in here, Steve?
Next item, Sally, number 9, which is 36 on the board list, is to increase funding for education and outreach on recycling, reuse and composting, as well as proper disposal of household garbage.
Good, thank you.
Steve, you haven't answered no one has spoken to my comment that they only put trash baskets at certain commercial corners. And that means that, for example, on the Upper East Side, you will find trash baskets on residential streets, but they don't put them on residential streets up here. So Bennett Avenue will not have a trash basket. Seaman Avenue will not have a trash basket, even though there's very much a need for the Washington Avenue, unless it's a commercial, like at 107th Street, will not have trash. That's incorrect.
I don't know.
Haven't they said that is just very costly?
Well,
I don't know. How can I mean? I live on a residential street. There are baskets on my street. Let me look.
Check it out.
Yeah, let me look into that. That may not be a budget issue, but let me look into that.
And that could be a council member request too, specific.
I don't know, it doesn't make sense to me. Okay, okay, that's number 10. No, that's number 9. Number 10 was to create an educational campaign about the federal public charge rule to inform immigrants of their rights to obtain health services and other benefits. Has this issue now been dealt with, I think, by a court decision? Tanya, have you been staying up to date on this?
The last I heard is that it sort of fell off the radar, but the last I heard is that they were going forward with that. There was that executive order.
I thought what I read is that there was a federal court decision saying that they could not impose this rule.
I would have to check, Steve. I have to admit I don't know. I'm sorry.
Okay, why don't we both check before now and
yeah,
and the public hearing?
Yes.
Actually, no. We have to do it in the next couple of days because I'm going to have to send this. I'm going to have to send it tomorrow. Okay, very good.
I'll check tomorrow. First thing.
And Steve, also, I think related to the one we were just talking about earlier, littering enforcement that was brought up in the chat.
Yes.
Is that? I don't know what the enforcement is for.
There isn't any.
I mean, that's like, would they have to catch someone in the act, right?
Yes. Right. I don't even know. We used to have, in the old days, we used to have a sanitation police officer assigned just to our district. I don't know what happened to those officers. That's something else we should look into.
Your opinion, because you would know.
I'm sorry, go ahead.
Yeah, I don't know. You might say this is not our area, but do you want to add, when we talk about trash collection, that we add parks in there? Or is that out of our reach?
No, yeah, that goes to the Parks Department. That goes to the Parks Committee.
Oh,
yeah.
Okay. All right, no problem.
But when you go to the Parks Committee, the Parks Committee hopefully is going to prioritize increasing the Parks Department maintenance staff who would be able to do more collections. I happen to know for a fact that the Parks Department lost 1,700 seasonal workers, many of whom have been doing garbage cleanup during the summer.
Wow. Thank you.
I heard all about that. Okay, okay, so we've gone through our priorities.
Can we talk about adding things?
Okay, go ahead, Ms. Fisher.
Yeah, I would say something about food. Hasn't that been one of the biggest needs in our community, is providing adequate food to people who are without during this pandemic? And I think we should comment on access to food. It does seem to be an environmental justice issue.
But
we're talking the budget here. So
what are we
I'm
asking?
just curious.
Yeah, what are we asking the city to do?
We're asking the city to provide access to healthy food for populations that need, including, you know, the elderly, including families, including those without.
So is that more funding for food pantries? Is that what you're specifically?
I guess food pantries, food distribution. Ideally, we're going to have something in the Parks and Cultural Affairs about farmland. Some of the stuff we talked about with the Washington Heights Inwood Food Council in terms of increasing access to farmable land so we can actually grow healthy food.
Okay, but Darrell has put his finger on it. I think if we were to phrase it, that we want funding provided for food pantries and food distribution sites. That would.
Yeah, I think that makes good sense.
Sorry,
I would agree
Steve,
with that.
sorry, there's no raise. At least I don't know where the hand feature is here on my phone.
I think there is one. Yeah.
But I was gonna ask about that because I feel like maybe we might want to check with Ariel, considering that they might also put food under housing and human services. And funding for pantries.
All right, let me find out where that money comes from and which city agency. Yeah, I think it may be something that falls under human services, not under us.
Okay.
Okay.
As long as it goes somewhere.
Yes. Okay. Yeah. All right. It's like the decimal meters, as long as it goes somewhere. Okay. All right. So. All right. So. We have an agreement that mental health services will remain as number one on the list.
Wait, Steve, can we add one more and making it kind of related to tonight's conversation around increased funding for targeted PSAs around COVID prevention and intervention services, perhaps?
One more time. Increased funding for.
What did I say? Oh yeah, increased funding for targeted PSAs on COVID-19 prevention and support services. I think what's kind of like focused, at least for me, is really particular around like targeted PSA and interventions. There should be models for interventions as we've seen like in the HIV epidemic and in other cases.
And I think that touches on a broader issue of just COVID in general and putting some sort of expense, budget item in there for that, like COVID prevention, communications targeting underserved communities, which could even include just masks, in more places.
Well, I don't know, the masks. I think what I think it's right to emphasize as we learned tonight. It's right to emphasize. I think doing more educational outreach. I think that would be a good thing for us to do. So
public education.
So I wouldn't want to just mention PSAs. I would want to mention an educational outreach campaign, including PSAs.
Can I just ask one question about that? I walked in late to her presentation, so I didn't want to bring it up. But when she depends on community leaders, community organizations, elected officials and stuff, that doesn't really work. What about people that teenagers pay attention to, like celebrities? I mean, why aren't we out there getting people that they'll actually listen to?
Influencers.
Yeah. I mean,
well, Well, that would be the point, I think, of the PSAs.
The rest of it to me is just a bunch of noise that they're gonna disregard like they disregard everything else.
And unfortunately, it's not just teenagers; it's grown people who are not wearing masks. You know, it's
There was a word in
grown
there
grown
that you
folks.
wanted to add.
I know it was. You heard that, right?
I did.
See, I restrained myself.
You did. I'm impressed. I'm impressed.
But to Sally's point, sorry, to Sally's point, it's really, I guess my point in bringing it up, it wasn't about like just, mass free for alls, education, or flyering free for alls, because we know that doesn't work. It's really about we have to have intervention models that do deeper work and not that like surface, event based work, if that makes sense. So that's why I was saying, like, as long as it, we can fit it in there. I don't think we have to specify the population, but ensuring that it is a targeted intervention for those who are, out of reach, whose numbers are climbing. Like, we can kind of phrase that a little bit better, but it has to be something that's a targeted model.
All right, well, but an educational outreach campaign that includes PSAs, no?
Yeah,
I
as
agree,
long
needs to
as
be in there.
long as it's hitting the Pandora stations of the people who need it, or Spotify, whichever way.
All right, did I get a sign off from Catherine?
Yes, it's good, Steve.
Excuse me?
Yeah, I think you did. Yeah.
Okay. All right, so at the moment we have 11 expense items as we're adding this one. And going back to the beginning now, mental health services is going to remain as number one. Substance abuse services, do we want to keep that as number two?
Yes.
Oh, yeah. Okay. I know one's gonna agree with me, but I think number 4 probably could end up number 2 because we're in the middle of the COVID crisis, and I think that it takes on a new importance.
All right, Tanya, since no one is going to agree with you, I will.
Okay. I'm just saying, because with the COVID, and we saw how people were dying, and because they had these conditions, right, from COVID, it makes people more susceptible. Yeah. Number
Okay.
Catherine.
Okay,
Yeah,
all right, don't say anything. Don't say anything more. You've already convinced me.
Okay.
All right. Do we have an agreement on that one?
Yes. I don't understand. Of what?
What is that?
What are we looking for agreement on?
Moving what is now number 4 with additional language about how we're trying to deal with conditions that increase susceptibility to COVID-19. We're moving that up to number 2 on our list.
That's fine with me.
All right, very good. Okay. Okay, so number 3 on our list was HIV/AIDS prevention and treatment services.
So that becomes number 4 then.
At this moment, it's number 4. Number 5 would be funding to ensure that all local public schools have health clinics. I assume we'll keep that as for the moment as number 5.
I put that down a little bit. I put that down a little bit. I would actually put the pest control above it.
Pest control above it, and maybe
and the noise above it too.
Okay, so we're going to bump it down to maybe number 8 or 9.
Yeah.
Yes.
Okay, so let me ask you between I want to the number 3 slot. I would like to argue for either the noise enforcement or for the trash basket collection.
I mean, I think the noise enforcement has been the biggest issue this summer.
Yeah.
I agree.
But the trash basket collection has been absolutely awful. So how about if we make noise number 3 and trash basket number 4?
Fine. I agree.
And
Okay.
then what's number 5 for after that? Is that HIV/AIDS?
Oh, God. Did I just, oh, God.
What happened?
Yes, HIV/AIDS is number 5. Did we lose Steve?
I heard, "Oh God," and then he was gone. Then I saw him moving. I think he did leave us. He'll probably log back on
No,
in a minute.
his thing is right there.
Is it?
It's
Oh.
logged in.
Oh shoot.
And he's unmuted. Steve.
Steve.
Did he have a heart attack?
I have to say, I think Zoom is much better than WebEx.
I don't like
agree.
this WebEx.
My agency got rid of WebEx for this.
Yeah, I agree too.
I've been
But
going
I
in
think
and out.
we're only
By
doing
the
it
way-
because there's 2 other meetings happening right now.
Oh, okay.
By the
I
way,
think that's the only reason.
I've put 2 comments in chat, and it says telepresence is not allowed to chat. And it looks like my comments weren't recorded.
I don't
Carol,
see.
are my comments recorded?
I haven't seen a comment from you. No.
Yeah, so they.
Are you doing it to everyone?
Yes, but I don't know any
Oh.
other way.
Yeah, I haven't seen anything. Steve? Oh.
Actually, let me add a comment. I don't know how.
Jay Mazer.
Steve on the phone, please. Call Steve on the phone.
Hello,
Yeah, we hear
Daryl.
you, Jay. Go ahead, Jay.
I was unable to open up both the priorities and the agenda. And I'm not really doing a very good job of navigating WebEx either. So I find this all extremely unhelpful.
It is definitely more of a challenge. That is for sure.
I opened up the agenda and the language just in my email. I'm holding it in my hand in my iPhone while I have the meeting on my tablet. That might help if you have both, Jay.
I just tried putting something in the chat.
Well, why don't you
Yeah,
call Steve?
it really doesn't. You can kind of see it.
Okay, can you hear me?
Well, we thought you were dead, Steve. What's up?
Yes.
You fell and you couldn't get up or something.
No, it was my phone died.
Oh, your phone's dead, not you. Okay, all right.
Yeah, well, yeah, it's not one and the same. Please. Okay, so the last thing I said was that I was proposing that noise enforcement be number 3 and trash basket collection be number 4.
Right.
And I was about to say
HIV/AIDS be number 5.
And which one?
HIV/AIDS.
Well, actually, I was about to say that the new item about increasing targeted outreach for COVID-19, I thought that should be number 5.
I think honestly we can move trash down to number, what would that be, 6?
The only problem is it's a huge public health issue.
Yeah.
And it's something that I have direct responsibility for, whereas the noise is really going to fall over to public safety in terms of getting that addressed. Even though it is a public health concern, I just worry about how our streets look now, and without really pushing this aggressively, how they're going to look.
I somewhat disagree.
I would say that noise is a public health issue.
Exactly.
And I will continue to push that. So
I agree.
Yeah.
And we've had, I estimate 75,000 people this summer whose lives have been turned upside down.
I'm not questioning. I'm just saying the solutions in terms of getting funding for the solutions. I'm not sure what solutions we can get funded out of the committee.
Yeah, no, I think you make a good point, because what we're suggesting here is that that the noise enforcement be provided by DEP, which is not really the answer to our question in our community
No.
with what happened over the summer. It's not really a budget issue for DEP that to that extent.
Right. And the
But it is though if DEP can also enforce. If also they also have noise meters.
No, yeah, it's true, but the things that they enforce against are not necessarily the things that we're most concerned about that have been bothering us over the summer. Listen, I'm a big support. You know, I don't want to reduce. I don't want to. I don't want to downplay this issue at all. But I just still want to keep it as a high item on our list. But do we have an agreement though that this new item about targeted outreach on COVID issues should be number 5? Or?
Yes.
Okay, put it ahead of HIV/AIDS. Sure.
Where's that? Yeah, where's HIV/AIDS then?
So that would either be 6 or if you want to jump it ahead of substance abuse, it would be number 6.
Yeah, 6 is good.
All right, substance abuse will be 7.
Sure.
All right, so then we have now it's up to either pet. Hello?
Yeah, go ahead, keep talking.
Next on our list is either pest control or the health clinics and schools, or education and outreach on recycling.
Pest control.
I'll support pest control. Yeah, I agree with what people were saying about that. I see that now. Yeah.
All right, pest control is number 8. Okay.
What was number 3 and 4, Steve?
What is number 3 and 4?
Yeah.
Number 3 is noise enforcement, and number 4 is trash basket collection. But actually,
what was number 2?
1 second. I actually now want to flip it. I convinced myself that that since DEP is not going to be the primary enforcer, I would want to make that number 4 and move up litter basket to number 3.
At that.
Did somebody say yes?
Yeah, that's fine.
Yes. Okay, very good. Okay, so now we're up
Is
to
that an issue throughout the district? I'm just curious.
Which one?
With the trash baskets.
Yeah,
Yes.
it's absolutely gross. Yes. Number 9 on the list now. It's either recycling or child health clinics. Oh, come on! It's got to be child health clinics. Okay, and
are there any parents on?
Okay.
Okay, no, but I would change the wording because, you know, at a child health clinic refers to a Children's Aid Society operation where, like, for example, they actually have a dentist on site and a whole deal. I think that we could say ensure that all local public schools have. Can we say, or is this caving in? Optimally, a health clinic or at least a licensed social worker and nurse.
I like that because I was thinking like it's really about access, making sure there's a nurse and a social worker on site.
Well, there's a separate program to provide social workers for every school. But okay, you know something? Yeah, we'll do that. Okay, very good. And I'm going to find an adjective, either comprehensive or multi-service health clinic. We need another. We need another word there.
Steve, all public schools have.
What is that?
How about this? That all local public schools have a social worker and registered nurse, and build toward a comprehensive health clinic.
Sounds good.
All right, let me look at that. Okay.
Look at that. See what you think.
Okay, very good. Okay, so we now have our list. We have the capital budget. The capital budget, we have 3 items. Number one on our list last year was to expedite the replacement of old water mains and sewer lines in our community, which has been going on. It was number 12 on the board's list. Number two was to provide additional garbage collection trucks and street sweepers, which is number 13 on the board list. And number three was to install green infrastructure such as bioswales to divert stormwater from the sewer system. And that was number 18 on the board list. Do we want to keep them in that order?
I think so.
Yeah, the board seemed to agree with that order, so why don't we just stay with that order?
By the way, Steve, where all do we need more new water mains? The stuff up on Park Terrace is been completed almost. Where else is it a big pressure in the community to get more new water mains and sewer lines?
Well, you know something, that's a very good question. My, I think maybe the other side of Broadway. I mean,
Won't the new rezoned area need it? Unfortunately.
yeah, well, yes, and part of that rezoning, I think, provided for a study that was going to point out where new water mains might be needed. We need to go back and revisit that, but let me look at that. Okay.
If you remember years ago when Stan Michaels was still the city councilman, I remember along Broadway.
Remember that.
What's that? You remember, Steve, years ago when Stan Michaels was still city councilman, along Broadway, along Fort Tryon Park, like by where I am on Hillside, there was along there huge black pipes that were laying there and then eventually got put in the ground. Remember those big black pipes? Were those sewer lines or water lines?
I don't. I remember we had the most awful experience with the replacement of the water main along Chittenden Avenue. It took forever, but I don't really remember those days. Okay, so.
But I'm just saying. So I think in the '80s. But I'm just saying. I think Stan was city councilman in the '80s. That these big. I mean, I'm telling you, they were like 2 feet wide or more.
Yeah.
Yeah. There was a lot of.
So I'm sorry, Steve. We wrapped up the capital expenses.
Do I hear a motion to accept our proposed list?
I make a motion.
Second.
I'm sorry. Who made the motion?
Sally.
Sally. Seconded by Darrell.
Yeah.
Yeah.
It was Betty.
I'm sorry. What about Betty? Betty, did you say something?
Yes, I did. I was the one who made the motion.
Oh, you made the motion.
Yeah.
Yeah.
All right, Betty and Darrell. Okay. So I vote yes. Betty votes yes. Tanya, how are you voting? Tanya?
Yes, I vote yes. Yes.
Darrell votes yes. Catherine, how are you voting?
Yes.
Catherine?
Yes.
Yes. Sally votes yes. Barbara votes yes. Jay, how are you voting?
Yes.
Yeah. Okay, that's 1, 2, 3, 4, 5, 6, 7, 8 yeses. That means nobody's voting no and nobody's abstaining. Okay, very good.
What about the oh, do we ask the other board members who aren't on the committee, or we don't?
Oh, God, yes. Okay, very good. Other board members, we have Mary and maybe Maria Luna.
And
I vote yes.
Maria, are you with us? No, Maria? Okay. Any other board members on the call?
Richard
Allman?
That one.
But Mr. Allman, how do you vote?
Yes, sir.
And what about members of the public?
I don't have that capability. Okay.
So members of the public should vote in the chat.
Okay. Well, can we? If they can they indicate so in the chat, and then Darrell can
just if they have an objection or abstain for some reason.
No. Let them indicate if they're voting yes, no, or abstaining, and then you can let me know.
Bernard, Bernard Groveman voted yes.
Okay, well, that's one yes.
I'll cut and paste it all and email it to you again.
All right, thank you so much. Okay, next item on the agenda. We've got the freaking agenda here. Okay, agenda. All right, I'm still working on the resolution on fireworks, so it'll be on the agenda for the next month's meeting. I'm sorry about that. I couldn't get it finished for tonight. Okay, the old business, DEP service requests. I sent you all the latest report for September. I can't believe they already had this report completed today to send it to me, even though the last day of September was only yesterday. So 623 complaints. The number one complaint for September, running hydrants. Number two complaint, construction before and after hours. And the number three complaint was ice cream noise from ice cream trucks. Okay, the city is back to rating clean streets and sidewalks. The rating for August for our streets was 92%. Somewhat surprising. But the rating for July was only 69.9%.
I believe.
And in terms of sidewalks, for the first fiscal quarter, so this is July, August, and September, the rating was 98%, and a year ago it was 99.7. The Ryan Health Center, one of the major health developments in our community in years, has now opened. It's a new facility on Wadsworth Avenue, just south of 181st Street. If you're in the neighborhood, maybe you should drop in and visit. I'm going to try to get there as soon as I can.
When did it open?
What's that?
When did it open?
Monday.
Oh, very good.
This is a very significant development. It's
progress on the ARC.
Excuse me?
What's the progress on ARC? The senior center?
Oh, I don't know.
Oh.
I think they said the end of the year.
End of the year? Okay.
Yeah.
All right. Is there any other old business? Is there any new business?
I have an announcement.
We're not there yet.
Okay.
Okay, no new business. We're up to announcements. I recognize Mr. Cochran.
Okay, just a quick one. Obviously, we're now in October. All the committees are going through the budget cycle. Also in October, the Traffic and Transportation Committee hears street co-naming requests, and there will be one at the upcoming one on Monday to rename or to co-name 168th between Broadway and Fort Washington, Healthcare Heroes Way.
Yeah, let me just say about that I still have an issue with the fact that the hospital has not been responsive to us and has not provided us with just basic, simple information about the number of patients with COVID-19 that they have been treating. And
all this echoing going on.
Excuse me?
There's echoing going on.
No, echoing.
Yeah.
Well, to me, that's important information that we should have the basis for that resolution, Darrell. And
there's two of you now, Mary. I don't know why.
I don't know. I can't understand any of it.
But Steve, yes, I understand what you're saying.
So,
I think there's any need to.
To me, that's it's important that we get this information from the hospital, and there's no legitimate reason why they don't provide it. And
they provide it for the whole system, but yeah, you're not specific to.
Well, I think the board should. I think the board should back us. I think the board should back us up on this request, and I don't think we should let the hospital off the hook. So
I mean, I don't think that's the place for it, but I hear you.
Well, I think if we're going to declare it Healthcare Heroes Way, we should know how many people's lives were actually saved, how many people were treated, what actually was the impact, what was being done in that institution. And I don't want to see them up on a stage being glorified when they're being so resistant and not providing basic information to our board. I feel very strongly about this. So
I think you need to talk to Ross and to
well, no, the issue is not with Ross, but I am going to have a follow-up conversation with people at the hospital. So I will let you know what happens with that conversation.
Thank you.
Okay. Are there any other announcements? All right. Hearing none, I think we can, it's now 9:06. We can adjourn the meeting.
Okay.
All right. All right. Thank you all.
Barbara, you're
everybody.
muted.
Good evening, everybody. Good night.
Bye-bye.
Bye, everybody.
Okay. Bye. Thank you all. Yeah, Daryl, you'll send me the chat stuff, right?
Hello? Hello?
Yes?